many deaths in America. There's too many gun deaths and there's too many suicides. In the United States alone, there were over 49,000 suicides that occurred in 2023. Also in 2023, there was over 46,000 gun-related injuries resulting in death. That's too many, and that is preventable, at least in part. I'm an advocate for gun control. That means restrictions or tighter policies regarding gun safety. And that is to reduce the amount of gun deaths or injuries, or at least risk that occurs. One of the arguments against gun control is that it's not guns that kill people, it's people that kill people. And to that, I wanted to entertain the idea, and I wanted to actually challenge it using statistics to see what the best solution is. Because I'm not necessarily an advocate for gun control, I'm an advocate for safety. And if gun control advocates for safety, then I'm all for it. If not, then we need to look for other solutions. So I looked at the statistics of what states have the most suicides per capita and the lowest suicides per capita. So New Jersey, per 100,000 people, is the safest with only seven suicides per 100,000 people. Wyoming is over 4 times that amount with over 30 suicides per 100,000 people. And I was wondering what was so unique about the two states. What did they do differently from each other, and what did similar states around them, top 5 and bottom 5, do differently that made them in that statistic, top 5 and bottom 5. The 5 safest states in terms of suicide risk also were consistently in the following categories: the least amount of, percentage-wise, the least amount of households that own at least one gun, because where there's gun access, there could be gun deaths and suicide, it's been proven. Least amount of firearm injuries or deaths. They have the highest percentage of health insured peoples, so the least amount of people who aren't insured. They also have the highest population density and tended to lean Democratic. Conversely, the states with the most dangerous suicide rates, they were consistently in the following categories. They were towards the bottom when it came to firearm deaths, meaning more people died, not less. More people died, it just is a worse statistic. They consistently had a higher percentage of households that own at least one gun, meaning more people have access to guns in their home. They also tended to lean Republican. They had less people who were insured, more people who were uninsured health-wise, meaning less people have access to therapy, or at least affordable therapy and mental health resources. And their population density was very thin, and they tended to lean Republican. I thought all that was interesting. I thought it proved that there's a correlation, and meaning moving forward, we know better, we can do better when we know better, and we have more information, so we can move forward with policy that actually saves lives and prevents this extreme number of suicides and deaths.